Okay. Okay. Welcome everybody, and the students of Bunker Hill. We truly appreciate that you join, and it's a interactive. It's a nice discussion. As you know, it's a pathway to science and medicine or workshop, and we are really thankful for the team, for the panelists here who joined us today. And our plan is we will introduce ourselves one by one. How our main theme is, because it's the name of the workshop is Pathway to Medicine and Science. So we are all here today. How we get here? What was our significant achievement briefly in few minutes? And from our undergraduate or graduate to here, it's a path, it's a story. And then we'll open for the discussion, and you guys are welcome to ask any question in chat room, or you can turn on your video, which is optional. But we want to know each other, and what's your career path? What's your goal? Any question you have today. So I will start with Karen. How about you start, introduce yourself.
Did you say Karen?
Yes.
Oh, sorry.
Karen, yeah.
I'm sorry. I'm not a panelist today. I'm really just an administrator providing support. But I'm Karen Osborne Green, and it's so great to see everyone here. I'm so glad you can make it, and I hope you get a lot out of today's panelists.
Sure. How about Jamila? Jamila, you can introduce yourself.
Thank you, Suman. Hello, everyone. My name is Jamila Ruiz. I am from Cali, Colombia, and I am a student of physical therapy. And my pronouns are she, her, hers. Thank you.
How about Donna? You go next.
Hi, everybody. I'm so excited to be here. My name is Dr. Donna Matthews-Gerald, and I am currently the Mass General Hospital attending veterinarian. And so I am a doctor of veterinary medicine here at the hospital. And I oversee the Center for Comparative Medicine, which is really critical to the preclinical research program. And I'd love to talk a little bit more about that. Should I do a little bit of my background, or we'll come back around?
Yes, I think that would be nice, because we have kind of 5 minutes each. So that would be nice.
Okay. And then Jamila, I think you'll come back. I know you probably have more to share. So my pathway to becoming a veterinarian started actually as a child. Like many people who decide to be veterinarians, there's usually some animal-related health crisis that motivates us to look at medicine. And it was actually undergraduate in my at college in North Carolina State University. I am originally from North Carolina and have moved here to New England, where I've lived for 25 years. But it was in college that I actually had my advisor, I was a chemistry undergraduate major, say to me, okay, Donna, let's just imagine you did not get into vet school, because I never thought about not getting into vet school. And at that point, I realized that my interest in science as a chemistry major, I loved experimentation, and my love of medicine. I said, okay, then I would consider human medicine if I didn't go to vet school. While I was in vet school, I did get into the North Carolina State College of Veterinary Medicine. And just to talk about blazing new pathways, I was actually the first African-American female to be admitted to the College of Veterinary Medicine in North Carolina State. So, you know, there's always ways of accomplishing your goals, and just because you're the first one doesn't matter, you know, just go for it. But in that time, I actually had an opportunity to work in a pharmacology, toxicology research environment, and really appreciated the intersection of veterinary medicine and biomedical research, and the need to assure that there's a balance between animal welfare and medical breakthroughs. And for those who are familiar with biomedical research, we call it the in vivo research. Every therapeutic, every diagnostic needs to be validated and needs to be proven to be safe before we can safely apply those new therapies in humans. And so I have a population of about 100,000 patients. Most of them are mice, but my department takes care of those animals and makes sure that we manage their well-being while they're helping us to create data and advance medicine. And so that is my pathway to being at Mass General Hospital. And I have been here for 20 years. And I will say that we have a lot of people in our department that start out on the care side of our patients and then move into the laboratories and really focus in on specific research endeavors or animal models. So I look forward to the conversation, and I'm happy to be here.
Thank you, Donna. Jamila, you want to say a little bit more about yourself, if you don't mind?
Well, I'm just a Bachelor of Science student, so I don't have quite experience. But anyway, as I told you, I am studying physical therapy. I will graduate in November. And also, I am a former student of BHCC. I studied there in the years of 2018, 2019, and I got a certificate in early childhood development. And currently, I am working in rehabilitation and therapeutic exercise for post-surgical patients, people with acute or chronic injuries, and athletes. But as a student in the field of physical therapy, I also have experience in public health, focusing on the promotion of physical activity, the promotion of early childhood health, and the prevention of different diseases like diabetes. So as you can see, all of this experience I have got it from my internships that I have done at my university, the Escuela Nacional del Deporte. But anyway, I will tell you a little bit more about it soon. So I'm happy to be here, and thank you for the invitation.
Thank you, Jamila. I think, Kyle, you want to introduce yourself?
Good afternoon, everyone, and thank you for having me. My name is Kyle Kozelka. My pronouns are he, him. And my current role or roles at MGH, I'm the palliative care social work lead and serve on the inpatient service in the Division of Palliative Care and Geriatric Medicine. I also serve on the Continuum project as the social work education and training lead, where I'm focused on helping train medical providers on how to have serious illness conversations with patients and families. And I also serve on the Health Equity Education Committee for the Harvard Interprofessional Palliative Care Fellowship, working to integrate topics of health equity into the curriculum and also developing both didactic and experiential learning opportunities for the fellows. And the fellows are MDs, NPs, a social worker, and a psychiatrist every year. My path to medicine was very circuitous and kind of winding. And it was a result of me following my varied interests and also continually expanding my understanding of what a social worker could do and what a social worker role was. So I grew up in a very small rural town in Iowa, less than 2,000 people. There wasn't a single working stoplight. And so we did not have any social workers in the town. Also kind of the majority of those in my town did not pursue formal education after high school. And also a majority of those in my town either took over their family businesses or were involved in agriculture in some way. So I was also the first in my immediate family to go to college or to pursue college. And so that was a very new experience for me as well. And while my parents were supportive, they also had no clue about how to go about doing that. And I feel like I lucked out, but it definitely was a scary process and something that was very unknown. And so again, I grew up in a very kind of small, homogenous rural town, and I identify as queer. And growing up in that community, I often didn't feel seen and also didn't feel like I had identifiable mentors or those that I could kind of identify with and look up to. Also in my community, topics that were deemed difficult or challenging often were avoided. And I found myself interested in having those conversations. And so I went to a large four-year state school, University of Iowa. For those familiar with the Boston area, it's the same size as BU, about 30,000 students, which is quite a difference from my small town. And so my opportunities were really expanded there. I was both excited and overwhelmed by the opportunities that were available. But kind of thinking about my experience growing up and thinking about what I might want to do helped me to kind of hone in on, given my experience growing up queer and not having many identifiable mentors or kind of a social network, I wanted something that had to do with communication and connection. Also, I was drawn to topics that others deemed as difficult. And so I wanted some sort of career that was about communication. And so I kind of fell into social work. It seemed like that was a good fit. I hadn't really kind of considered that before because it wasn't an option in my town. And really at the time, my only exposure to social work was kind of very stereotypical kind of understanding of nonprofit realm, governmental work, like Department of Children and Families, and working primarily with children and families. And that was kind of my understanding of what that role would be. And the earlier part of my career very much fell into that, working with children and families in educational settings or kind of nonprofit settings, and also in the mentoring world. I then went on to pursue graduate school and a master's of social work here at Boston. At Simmons University. I was also one of the first in my extended family to go to grad school. So that was also a new experience and very intimidating to think about not only the financial burden, but also the commitment that it took to kind of put yourself through graduate school. And that really expanded my idea of what social work could be. And my internship during my master's program was at an outpatient community health center in Roxbury. And that was the first time I really saw the interplay between social work and the medical field, and saw how closely related they were. And after that experience, I pursued a postmaster's certificate program in the treatment of trauma. That exposed me to kind of understanding social workers could be leaders in certain areas. It could be role models, they could be educators and trainers. And that was something that I hadn't necessarily seen before. Often, if we're thinking about the medical system, unfortunately, sometimes has a hierarchy, and social work isn't always at the top of that hierarchy. And that had kind of been my previous experience, but kind of really through that program allowed me to see, oh, social workers can be leaders. Social workers can be on the forefront of some of these topics. And so after I completed that program, I then went on to complete a postmaster's fellowship program at Beth Israel here in Boston in the cognitive neurology unit. And so to help support myself in college, I had been a personal care assistant for a man with multiple sclerosis. And that was a really eye-opening experience for me, both personally, but also from kind of like a medical standpoint. And so pursuing the fellowship in cognitive neurology allowed me to kind of really explore that in more depth. And so I was lead social worker and working with multiple different patient populations, those with dementia, Parkinson's, ALS, MS, Huntington's disease, and also a transcranial magnetic stimulation clinic, which is similar to electroshock therapy, but done with magnetism instead for the treatment of intractable depression. And so that also was a lot of close collaboration with medical teams, joint visits with doctors and nurses, participating in clinic days, and also case presentations and research. So again, you're getting this theme as I went along in my career, I started, my view of what I could do kept expanding. And so that led to my current role here on the inpatient palliative care service at MGH. Many of the patients I was caring for at Beth Israel, while I wasn't in a palliative care role, were dealing with chronic life-limiting illnesses. And so many of the topics and support I was providing were related to palliative care. And so I have a clinical role here on the inpatient service, supporting patients and families experiencing uncontrolled symptoms, chronic and life-limiting illness, and end-of-life transitions. I also teach and present on various topics to medical providers here in the hospital, including serious illness conversation trainings. And as I mentioned before, serving on the health equity education committee for the fellowship program as well.
Amazing. Thank you so much, Kyle. It's very, very informative. And I'm glad you are here. I mean, to be honest, we are all like PhDs and MDs. But when Rose told me that Kyle will be here, I think we have a different view. We have a different perspective. I love it, actually. Yes. Rose, how about you?
Hi, thank you so much. I have a little, I guess, some photos I could share. So is right now when I can like share my path. So here we go. Okay. So for mine, I'll just share a little bit about what's not written in my information here. And let's see. Okay. So my path, just like you, I actually started at a junior college or community college in California, Northern California. And what I'll share with my for my 5 minutes is actually like the ups and downs and like the lessons I've learned from SRJC to MGH. So I basically started, let me move this. I started in Northern California at SRJC, where I was a student, and then transferred to UC Davis, where I got my bachelor's in nutritional biochemistry. And just like Kyle, I was the first one in my family to get a bachelor's, first one to go to college. And then I transferred, well, after transferring to UC Davis, I then went to Los Angeles. I worked there as a technician in a neuroscience lab at UCLA, and then drove across the country and got my PhD at University at Albany in upstate New York, and then now a postdoctoral fellow. So from each point in my life, I'll share a little bit of lessons I've learned. So first, this is my little brother. Just like a typical immigration story, I was separated from my family for 10 years. And it was right after high school that I was reunited with them. And I wanted to get to know them. So when my friends all went off to college, I stayed behind, attended a junior college, community college. And I wanted to make sure that my parents and my brother were all set and, you know, adapting well in this new country, this new environment. And while I was taking child development and nutrition classes at the JC, my mom became pregnant with my youngest brother, who is in this picture here. And although we didn't have much money, I still wanted to make sure that he had proper, you know, stimulating environment and also appropriate and proper nutrition, at least with what we could afford. And so he really was the one who started my why. I wanted to know how we can best protect children despite the environment that they are born into. So when I knew that they were okay without me, I then transferred to UC Davis. I was still really interested in terms of how nutrition could potentially be influencing someone's health, as from child to adulthood. And so while I was there, one of my teachers, one of my TAs in class actually approached me after class and was like, "Hey, do you want to be my research assistant?" And I'm like, "I don't know what that is, but sure." And it was really fascinating. And I had a 2-year window at UC Davis and then became a research assistant in 2 other labs for a total of 3 labs. But then I took a class, it was nutrition and aging. And I thought, well, you know, you could have a healthy body, but you also need a healthy brain if you want to have a fulfilling life. And so then I kept following that curiosity. And so finally, my boyfriend at that time, who is my husband now, was transferring. He also started at SRJC, transferred to UCLA. And I figured, well, why don't I just work at UCLA? I'm totally burnt out from SRJC and UC Davis, like working constantly, school and work. But when I was there, I didn't know anything about neuroscience. And in fact, my advisor was like, "Hey, here is a 3D software. Let's learn how to like use it and make a microdrive that allows us to record brain cells in the rodent model." I'm like, okay, well, I wanted to go to art school. This is my chance to like create something that's like a bit like artistic in a way. So we ended up developing that, making that microdrive. But it was more in the artificial intelligence. I was still really interested in child development, neurodevelopment, mental health. And that's when I got my PhD at University at Albany, where I learned more about maternal mental health. But I was still really interested how the mother's mental health and during pregnancy and postpartum could also be affecting the baby. And so during a lesson here was I actually had to restart during my 4th year. But with luckily being in a new environment and with a great PI, this is my PI, Dr. Damien Zuluaga, I was able to restart my dissertation and finish in 2.5 years. And then, so my, sadly for my family, I kept moving east and I'm now in Boston. And what I'm interested here now is how is mother's health during pregnancy, and because during the pandemic, SARS-CoV-2 infection during pregnancy affects fetal brain development. And that is basically what my current study is right now, in addition to nutrition and obesity and how that could affect fetal brain development. So this is basically my pathway. And I think also, Jamila also has a presentation that that I would love to see.
I was
thank you. I'm really looking forward to it.
Thank you, Rose. Just give me a moment. I will share my screen. Yes. Just give me a minute. So, thank you, Rose, and thank you, Suman. I'm sorry. Okay, so hello, everyone, again. As I told you, my name is Jamila, and I was part of the BHCC students while I was there in Boston in 2018, 2019. I'm 23 years old, and in November, I will graduate as a physical therapist at the Escuela Nacional Deporte here in Colombia. So I guess some of you might be wondering, what is physical therapy? Physical therapy is a professional career in the area of health whose subject of study is the human body movement as an essential element of the health and well-being of the person, the family, and the community. Its interventions are based on the application of different sciences, such as physics, chemistry, biomechanics, neuroscience, and many more, with the aim of improving quality of life. So as a student in the field of physical therapy, I told you I have experience in public health, focusing on the promotion of physical activity, the promotion of early childhood health, and the prevention of different diseases. So don't worry, this presentation will be entirely about the definition of physical therapy. So what I would like to do is to share part of my journey in college and now as a soon-to-be physical therapist, my ups and downs, and some of the magic of being a physical therapist. So while I was in college, I felt many different emotions. I remember the first days of class, my motivation used to be that finally I would study something that I like, something that I am passionate about. But as the months went by, I started having thoughts saying like, I'm not good even in what I like, or I can't do this anymore. And this is a common thought, I guess, among college or university students. Of course, this is the so-called imposter syndrome. So there were times when I just wanted to give up because I couldn't see any future for me in the field that I chose. And this happened to me while I was a student at BHCC and when I started my bachelor's degree in physical therapy too. So what helped me the most in situations like this was remembering why I had studied. For me, the reason why I chose this field is because of my desire to serve, to give back to the community. Because I feel like I have been given so much that it is impossible not wanting to share this with others. And physical therapy is the way I chose for this purpose. There's a statement that I heard when I just began my degree, and it is that even if we don't save lives, we make life worth living. So imagine that you're walking home or hanging out with your friends, and out of a sudden you have an accident or a stroke. You are taken to the hospital, perhaps you get a surgery, and then you wake up again. What happens next? Sometimes there are consequences or sequels after this accident. Perhaps you lose the ability to walk or the ability to move one of your hands. Then you will have to see your doctor or a specialist once every 6 months or hopefully once a month. But you will have to see the physical therapist practically every day to restore this function of your body that you just lost. You will have to learn how to walk again or how to move your hand again. You will need to train your muscles and gain strength to achieve this purpose. So just imagine if physical therapy wouldn't exist in the world. Yes, the surgeon will make everything possible to save your life, but what's next after you open your eyes and realize that you can move a part of your body anymore? So the statement I mentioned before becomes true. Although we don't save lives, we make life worth living. So going back to my learning process, it was mostly about facing and feeling discomfort to achieve my goals. When we participate in an educational program, whether it is learning a new language or entering university, it is implicit that we have to leave our comfort zone or safe space since we are faced with a totally new environment. For me, I was afraid of the field that I chose because it was more complicated than I thought at the beginning. So a few months after I started my path in physical therapy, I realized that having a support network changes things a lot. And they remind you or support you that you are capable of doing different things, that you are good enough for this field that you just chose. Stepping out of my comfort zone has taken me to places and opportunities I couldn't even imagine for myself. I was fully funded to study English, then fully funded to study and live in the US. I even had a meeting with the Secretary of State of the United States, Mr. Anthony Blinken, when he visited my country. Last year, I got a full scholarship from the Ministry of Science and Technology here in Colombia and got a diploma in STEM and project formulation. And my current university will pay for my studies, where I can choose a specialty such as neurorehabilitation or physical therapy in sports. And all of this was possible not only because I have dreamed about it, but also because I have ignored as best as I can the voices and talks that tell me that I am not good enough for the field that I chose, for the physical therapy or whatever you are going to choose for your future. So my advice for you is don't be afraid to step out of your comfort zone. And I may have achieved all of these at the age of 23, but that doesn't mean that's the mark for everyone else. So live your process and enjoy it, and just enjoy the journey. And like BHCC's motto, always imagine the possibilities. Thank you.
Thank you. Yes, it's amazing. So Rose, are we missing any other than Bunker Hill? And I will introduce very quickly and then we'll move to the question answer. Any panelists I'm missing, or we covered everybody?
We covered everybody.
Okay.
Perfect. Yeah.
I know, Dennis, you want to introduce yourself for a few minutes? I know you're not in the panel, but just you work for an important position for the workforce development.
Sure. Hi, everyone. My name is Denise Mitko, and I work at Bunker Hill in the Department of Workforce and Economic Development. And I see a few people that I recognize here, and it's really nice to see those of you who I haven't met yet. As you likely know, the division works across the college with many different students and in many different projects to make sure that particularly those of us who are working and learning at the same time get the most out of both experiences. So it's really nice to see everyone here today.
Thank you. So, and I promise I will make it very short and brief because we need to move to the question answer. But it's an interesting story I want to share with you. Just after 9/11, me and my wife arrived in Denton, Texas for a master's. And then we liked Texas. It was not the right program in University of North Texas. We moved to New Mexico, which was lovely time. Albuquerque, Santa Fe, I miss Southwest. And we used to go to Colorado all the time, and dogs, no kids. And we enjoyed the party, the work, everything, the beauty of the White Sand Missile Range and Albuquerque and all of those areas. It's a different culture. So after PhD in molecular biology, it's a different lifestyle. We moved to Washington, D.C. And my wife joined the Anthony Fauci's department division, NIAID, and Tate Pearson, who directly report to Fauci. And I followed her basically because I was more yeast and agriculture, plant fungal interaction. So I joined NIDDK, but quickly I understood I'm not really a person for bench science. So I did okay. I was feeling claustrophobic in the lab because my PhD program was more like a outdoor activity, collection of samples and biochemistry in the lab. So to make the long story short, I understood there is I contacted the office of director as a fellow in NIH. I moved to science policy in the building one. That was the best time, but as a fellow, it was not a job. I worked with Capitol Hill, I worked with National Academy of Science, just how it happening, all the discovery, how they give it to the legislation, give it to science subcommittee to get the money and to share their work. So that was the whole my help postdoctoral fellow, help community college student, help the external funding. So it was a fellowship in education policy, but that was not a job. So my wife completed the postdoc and moved to Madison, Wisconsin. And at that time, I started to teach part-time in a community college, Northern Virginia Community College. I got a full-time job too, because remember, fellowship is different in science policy. To get a job in Capitol Hill is different, or in White House. But I love the policy part. I love the politics and science. And then we moved to Wisconsin. I taught there in Ajut College, a small Catholic college. And then the Takeda Pharmaceutical moved here to MIT campus in the research part. And now, but that's her story. And she was always a successful biotech, bench scientist. Now she moved to gene therapy. For my case, I was desperately looking for a job because I want to do some education policy, but I have to survive, right? My bread and butter is teaching. So I moved to Bunker Hill in 2017. And so I was teaching courses. Then I was trying to find my path where I am most happy. Yes, I love teaching, but I was getting a little exhausted. And it was not boring. It was very nice to deal with the student, but it is nothing new to me. So when the job opening offered to, and you see my email, most of you students, I'm the new STEM coordinator. So our Dean, Laura Rubin, who is not here, she's giving a division meeting. So I got the job, and I thought this is me who I can help the community, help the student, help all my STEM students and program in a better way than I'm a professor. Nothing wrong with the teaching. I still love to teach. But this is me. Here I am, and I'm thinking not only the organization, talking to the partner, talking to industry, talking to Harvard, MIT, like university, all the PI. So that's my path. So from science, bench work, to policy, to teaching, to back to again policy, education policy staff member. So with that, I think Rose, is that okay? We'll open for question answer.
Yes, definitely. Thank you all so much for introductions. I appreciate it.
So you guys are welcome to, and I have a couple of questions for the panelists, but I want you to, I strongly encourage you guys ask question. Any students, either in the chat room or raise your hand or just start your conversation.
Yeah, I like that. Yeah, I hope you.
Someone, if you want to start your question, if you'd like, I think that'd be great.
Yeah.
I heard somebody is talking, right? Or no? I did hear somebody.
Yes, yeah, if you wanted to start with your questions, that would be great while students are able to gather their questions.
Sure.
Perfect, thank you.
Yeah, so I'm thinking I can start with Donna or Rose. I mean, you can, my question is, what are the, like, anybody has anything other in your mind you want to be? And then we heard from Donna a little bit about it, like how you switch in the way of your path. You thought, no, this is not me, this is, I want to do something. And that's a part of the discussion. Always in our mind, we want to be engineer. Then you ended up like basically a doctor. You never know.
Sure, I'll be happy. So as I shared, you know, I actually had a pet get hit by a car when I was 7 years old, and had multiple pelvic fractures, a little small Chihuahua mix. So you can imagine Chihuahua versus car, the Chihuahua is going to lose. And it was through the experience of healing, of participating in the care of that animal that I really became recognized my love of medicine and nurturing and care and recovery. And I pretty much made the decision that I was going to grow up and be a private practice veterinarian in my town. I even knew which practice I was going to come back and work in. But through undergraduate, and as I said, I was very focused at that time, and I really appreciated my advisor who said, don't put yourself in a box. Don't, you know, think about what else you might want to do just to keep your options open. And while I did continue to pursue veterinary medicine, I really appreciated that medicine crosses, there's multiple species that need medical care. And it was at a time, life events happen. And it's when you take advantage of those life events that you create a pathway that you probably would not have laid out. And so at the time that I was in veterinary school, there was a lot of public pressure to really care for and address the needs of the animals that were being used as a part of biomedical research. And so this whole new area of what became known as laboratory animal medicine, the federal government actually said any person who does research, any institution who does research using animals must have a veterinarian on staff. And I happened to be in, and the reason I got this job was because I wanted to work around the vet school, and they were opening, the school was brand new, as you heard, and they were opening up new laboratories. And so they were looking for students to unpack the boxes, put out the pads and set up the labs. And so I ended up in a pharmacology toxicology lab where we were unpacking the boxes, setting up the scales, and really starting the research and developing new methodologies that would be used in the lab. And so I actually became a member of the lab, thinking I was just a student who was going to set up equipment. And so, once again, you end up, I really believe that life puts you where you need to be, and that your job is to take advantage of that. And so I really got engaged in the research itself. And it was because of that experience that I really said, I don't want to leave the front end of medical advancement. Being in private practice put me at the back end, honestly, because it was the discovery side that got me really excited. So that gave me an opportunity to decide, okay, private practice is something that I may do in the future, but this is what's exciting me right now. And that was more than 30 years ago. And it still excites me right now. So, and I can still today, I am a lifelong learner. I applaud people who are always looking for what else they need. And today I can look in new directions. I have taken on a lot of additional responsibilities, including the development of staff and making sure that the workplace, the research labs, our facilities actually provide all of our employees a place where they can be successful. And so how we do that has become an additional skill that I've developed. So as much as I'm in medicine, I'm also looking at how we manage, and how we lead our organizations. But I could, in my area of veterinary medicine, we say, the beauty of veterinary medicine is you can go in any direction. You can go into environmental health and evaluate wildlife assessments, ecosystems evaluation. One Health is a new component. I would encourage you all to look at One Health. It recognizes with this pandemic that the relationship between animals and humans is extremely close, and that we have to look at how the ecosystem supports them all. So I'm a veterinarian working in a human hospital, that's not a path that most people would normally see as obvious. What I will say, as I said, take advantage of the situations that are there. And the thing that I always tell anybody I mentor is find out and follow your passion, because there's going to be a day when you don't want to go to work, right? There's going to be a day when I'm just exhausted. And it's the passion that you feel for your work that's going to get you out of the bed, get you dressed, and make you go in and do your best. And so if you're not feeling that, it's always going to be a struggle. So I really encourage you to, translate what you're passionate about into what you can do as far as your career path. And I probably could change jobs today and go in a lot of different directions. Right now, I enjoy so much what I'm doing that I'm happy, but I'm always open to new possibilities.
Thank you, Donna. Yeah, yes. I want to make sure any student has any question before I go to my next question. Anybody has any comment or question? So Kyle, I have a question for you. What you said about the small town, grow up, and then you are here. So that echo with many people. It's from other country or from different ethnic background and all of those. So what do you think? I mean, any message for our students that sometimes they think, oh, I cannot be like this. I can be a nurse, but I cannot be MD, right? I cannot be a Rose Guzman like where she is from community college from that California here, a Harvard postdoc, MGH postdoc. So any comment, Kyle, that how the path could be?
Yeah, absolutely. And I think it'll piggyback off what Donna just said. And I think it's really recognizing when those opportunities come up. I think it's so easy for society to put us in a box, but also for us to put ourselves in a box and think this is only what I'm capable of, or this is what this path means, or this is what my life is going to be, and to not kind of diminish any challenges that any individual person is facing, but really thinking outside of those parameters that are put on us, whether we're doing it ourselves or others, and really think, what are my interests? Where can I apply myself? Where can I learn from? If it's not a formal kind of job or formal education experience, where can I learn informally? Where can I start to get that information now? And I think to Donna's point before too, is really what you're learning are skills. It's really easy to think like I'm on this path to get to X career, but what you're learning along the way are skills that are applicable in a variety of different careers, in a variety of different fields. And it's really learning how to shift your mindset and how to spin those skills in a different way. So even though my path is very different as a social worker, I've taught preschool for immigrant children. I have been an adjunct professor at the graduate level. I've done outpatient psychotherapy. I've been involved in a mentorship program. Like if you look at it, it looks very chaotic from the outside, but really there's a clear path and a reason why I went from each place. I was applying my skills in a different way, working with a different population, challenging myself in a different way, and exposing myself to new skills. And I think coming from a small town, like I moved to Boston, not knowing a single person here, moving here with one suitcase on a plane. And I did that all on my own. And so really thinking about that's scary. That wasn't an easy thing to do. I had to start over in a new place and then think about putting myself through graduate school, which is not cheap. But really kind of leaning into those opportunities and not shying away from the things that were scaring me, but thinking the fear can be a good thing. The fear can be a motivating factor, or a fear that like, this is something I need to lean into. It's making me uncomfortable for a reason. Let me explore that a little bit more.
Mm-hmm. Thank you, guys. Rose, I have a question, but anybody can interrupt and make comment or question. Rose, you are who you are now, and you can. Many students ask that if I do PhD or like that, it's really difficult for the financial point of view, for the lifestyle point of view. But when I talk to you, or anybody talk to you, you are calm, you are humble, you are easygoing, right? I mean, but what you're doing, we all know it's a long journey. The PhD and postdoc, you are in a famous lab. So how your daily life, how you manage yourself, the balance, work-life balance, and all of those.
Tough balance. I am also a new mother. I have a 6-month-old, and so I may be getting 4 to 6 hours of sleep right now. But I think what has helped me is that I've always wanted. So I am the first one in my family to go to college, just like Kyle. And for the longest time, I've always thought, oh, if education and if lab work is the toughest thing to have to deal with, then I have it pretty good. Back when I started junior college or high school, we're like low SES background. I was going to class like 6 a.m. or 7 a.m. whenever high school students start, 6 a.m. until like 4 p.m. And then from 5 to 11 or midnight, my family and I, my parents and I, my brother and I would clean schools. And that was a tough thing where it's like, and so I knew that education was like my way of helping my family and myself and, changing that life moving forward from my family. And so I think just gratitude is what keeps me going. Gratitude and appreciation for everything that I have, and I don't take that for granted. You know, when I think about a lot of the children in the Philippines I grew up in, I know the devastating effects of poverty. And so what I have right now, I don't take advantage of that. And I try to use whatever platform or whatever resources I might have, I try to give that back. And I've always wanted to do that since I was a student at my community college. It's like giving back. And yeah, I think gratitude and appreciation for what I have is what keeps me going and what helps my balancing with all of the responsibilities I have in life. It's tough, but it's my why. And that's what, like Dr. Gerald said, if you know your why, then that will help you keep going despite, you know, waking up sometimes and like having a hard time to go to work. Like knowing your why and your purpose helps a lot.
Yeah, it is emotional and passionate, no doubt, yes.
Can I just add a little comment about that? I think that everybody needs to recognize and celebrate the resiliency that comes when you are struggling through your work-life balance. I actually am the mother of 4, single, I'm divorced, and they're all grown now. So you kind of get a chance to appreciate that you did it and that you did it, you know, it wasn't always pretty. It can be messy, but you do it. And doing it builds a resiliency that actually is be appreciated in the workplace now, right? Because change is happening all around us and we need everybody on board to navigating that change. And those who are resilient are the ones at the front end. So if you have work-life struggles, I know the mother at 6 months is hard. It's very hard. But you are learning resilience. And I just think it's worth acknowledging that.
Definitely, yes. So there is a question from Jenna in the chat room, and we can talk about the mentorship program. That's one of the main theme that she asks, that wondering what are the mentorship program and internship availability. So Rose, you want to address about that mentorship program, the initiative?
That's a great question, and I'll make this brief. So we are going to start that in the spring of 2023. So what we'll be doing is workshops for this semester. So we'll be doing 2 workshops. Today is the first one. The second one will be in December 8th. And then we have 2 more in the spring. And then the mentoring program will start next spring of 2023. And so Dr. Rubin will be able to provide more information on like students who might be interested in the mentoring program. And I really appreciate your patience while we get all of that figured out and planned out. Thank you.
And it's a collaboration, right? BHCC and the mentorship, and there will be a process and application, and it's based on availability, but it's a path, definitely. Yeah, I was just wondering, anybody has any question or comment from the students, or then
and I'll also share that we have a summer internship program,
yes,
and we have worked with Bunker Hill, and I'll make sure that you all have our contact information, because we are always looking for, and we've even talked about co-ops. So maybe there's an opportunity to work while you're in school as part of the education. We really are hoping to build a strong pipeline through us, potentially into, like I said, the laboratories and more focused research opportunities.
Yeah, I truly appreciate, because what happened in biotech company, there are prevalently nothing wrong with Northeastern, BU, Harvard. It's a co-op, they are more ready for internship, right? And they know the path. They go to the that particular biotech company and start the internship. They have a connection and internship partnership. We started this, they want our students for definitely, but MGH is more, MGH Harvard, I feel like we are more better partnership because they understand us more. To be honest with you openly, like when we have intern in MGH right now, they are more like deep into the work and patient care and all of those. In the biotech, sometimes they enjoy, sometimes I think they are not ready. So you're working on that path, how they can accept a Bunker Hill Community College or any community college student in their research and development, in their clinical program, in their regulatory program. It's a different ball game, right? But I think the biotech companies and Boston needs to be ready to accept community college students. It's a different interaction. So they need to care more about, because our students work, our student has a life, our student taking classes. It's not that 24/7 they can work, right? I mean, that's the thing we need to discuss, open discussion in the community that encourage more so that our students get motivated to go to you guys.
Yes, and we've started that work. So that's why I think if there are people out there who want to move into the in vivo or biomedical research environment, this would be an opportunity for us to talk more.
Yes, thank you. Jamila, so I have a quick question. So what's your goal? You want to be a physical therapist, or you want to go to because you are so young, you can go to a medical school or something like that? Any future plan?
Well, yeah, first of all, I want to graduate. I will graduate in November this year. And my current university offered me a full scholarship to do my specialty, where I can choose neurorehabilitation or physical therapy in sport. So I want to finish that first. And after that, I would like to do my master's in the US, maybe. So I'm looking for opportunities to travel and maybe share my perspective of physical therapy, because I know there are some differences in the US education or in Colombian education. So that would be a really, really great opportunity for me. So I'm looking forward to it.
Perfect, thank you. Yeah. Rose, I think we have we are ending at 2, right? In few minutes. So if you want to mention anything, or if you have any comment or.
Hi, yeah, thank you so much. I really appreciate our entire panel. We appreciate your time. I know that we're in like different time zones even, and so Pathways to Science and Medicine, this is really for you, the students. So please let us know. Feel free, there is an email on the flyer, let us know if you have any questions, any feedback. And again, we are going to have our second workshop on December 8th. And so we will, all the people that are in attendance, hopefully we can get your emails and we can provide more information to you. So the second workshop will be December 8th at 1 p.m. And again, this Pathways to Science and Medicine, PSM, is a collaboration between Bunker Hill Community College, Mass General Postdoc Association, Harvard Med Postdoc Association, and MGH Center for Diversity and Inclusion. And I just want to also, in addition to thanking our panels, also want to thank our collaborators, Karen Osborne Green, who is from MGH CDI. She has been an absolutely amazing and a key person to getting this initiative up and running. And also Laura Rubin, who can't be here, but Karen and Laura have been absolutely amazing in keeping it going. It's this initiative is only as good as your team, and I'm really grateful for this amazing team that we are a part of, and we are so excited to provide more information and truly build this community between all of the institutes. And like what Dr. Gerald said, this is like building community, bridging the conversation. And thank you so much for providing and sharing that opportunity for summer internship. That is what this workshop and what this initiative is about, is to build a community and go beyond Harvard, go beyond MGH, and seek students, and just to let you know that you do belong at MGH, at HMS, wherever you want to go, you belong, and regardless of your start, you can get to where you want to go. So just thank you.
Thank you. So see, Karen, you are not in the panel, but you are a key important person. So you need to introduce yourself, right? Yes.
Yeah. I mean, I'm just so happy to, be a part and to support Rose. I know Rose came to us with this idea, and I love the fact that her passion is just so incredible. And she's really the reason. I know she's thanking us, but she's really the reason behind all of this. And I just want to thank everyone for participating today. And I know some of the students didn't have questions like that, but I know I got a lot out of the conversation even, you know, and I look forward to the workshop in December, and also the mentorship program as well. So thank you again.
Yes, and our Dean, Dr. Laura Rubin, has the full support, and from the background, as you know, Karen and Rose, she's always working, encouraging, motivating, and all of us and the student. It's a big support from the Dean of Science. Yeah. Okay, so we have the next one in December. In a different weather, maybe on a snow day. You never know.
That'd be great.
Yes.
Well, again, thank you all so much. I
Okay,
appreciate it. And